Hey there, welcome to GrowMed. GrowMed is a one-stop guide for the FMGE aspirants. So join with me in this journey of FMGE where we will be making the studying more easy, effective and enjoyable. Don't forget to hit the subscribe button and turn on notifications so you never miss a study session. Let's get started. In this video, we will be discussing some important points from the surgery which are asked in the FMGE. So the ATLS protocol, it is a must-do topic and every year 3 or 4 questions are asked from this, the general surgery. So it becomes important for you to look at all the points regarding the general surgery. So this is a quick revision kind of a video for you guys. So the ATLS protocol has 5 components in it and those are the A, B, C, D and E. So the first one standing for the A is the airway, then for the B it is breathing, then for the C circulation, for the D it is disability and E for the exposure. So these are the 5 points which you must know, and the question can be asked in various patterns like giving 3 or 4 questions and asking which of the following is correct, or simple one-liner like, for example, the one which was asked in the recent Jan exam, that is a patient had maxillofacial trauma and how will you secure the airway of the patient. So if it is emergency, then you will be doing needle cricothyrotomy and the definitive is the tracheostomy. Okay, so this was asked in the recent exam, so it becomes important that it can be asked in the future exams. So the airway management, how will you do? The definitive management is by intubation, oral endotracheal intubation with cuffed endotracheal tube. Along with that, you must also know the indications where we will be using the ET, and that is when there is airway obstruction, CNS depression, noisy breath, facial trauma and the Glasgow Coma scale less than or equal to 8. If you find these things in a patient, then you will be straight away going for the ET. But there is an exception, that is the maxillofacial trauma. So whenever a patient of maxillofacial trauma will be coming, if it is emergency, then you need to do the needle cricothyroidectomy. But the definitive will be the tracheostomy. Another important point which you must remember from this airway is that nasal intubation is contraindicated in case of fracture of the skull base and cribriform plate. Then the next important thing is the breathing. So while breathing, the things you will need to secure for breathing is do the ventilation and oxygenation. So we will be looking at certain parameters, and those are the rate, depth, precursion and auscultation. Then the famous question asked from this breathing is, whenever a patient with tension pneumothorax is coming to the emergency, how will you manage the patient? So this is a famous question of the FMG is, that is, we will be using the wide bore needle in the 5th intercostal space. In the adults, it is the 5th intercostal space, and in the pediatric patient, it is the 2nd intercostal space. If the patient is having massive hemothorax, then you will be doing intercostal drainage. That is the ICD insertion. And if there is breathing abnormality because of severe pulmonary contusion, then the management will be mechanical ventilation. In this severe pulmonary contusion, the respiratory muscles will be paralyzed, so we need to give the mechanical ventilation. Then the third important point, that is the circulation. You need to first look at the two parameters, that is the pulse rate and the blood pressure. And if there is tachycardia, the pulse rate more than 100 beats per minute and hypotension BP less than 100 mmHg, then we will be calling it as a shock. Then questions are also asked on how do you manage the patient with the shock. So when the patient is in shock, we will be using 2 large bore green cannulas. So the cannulas, its size, its color and its use is also an important topic because questions are also asked on this. So let's talk about shock now. The management we have already looked at, that is the two large bore green cannulas. Okay. And questions are asked on the formula. How much fluids you need to give and what kind of fluids you need to give. So there are crystalloids and colloids. So based on the type of the shock and the amount of fluid loss, you need to choose which fluid you will be using. So for adult it is 1 liter warm isotonic crystalloids, and for the children who are less than 40 kgs it will be 20 ml per kg warm isotonic crystalloid. Then moving on to another very important one liner, that is the monitoring fluid resuscitation. So the best parameter to monitor the fluid resuscitation is the urine output, and in adults it should be 1 ml per minute and in children it should be 0.5 to 1 ml per minute. The question can be asked in other format like which of the following parameter is used to see the success of your fluid resuscitation. ठीक है, तो success of the fluid resuscitation that will also be calculated using the urine output. ठीक है. Now another question, important question, that is amount of fluid required. How will you measure how much amount of fluid is required? And that will be done by the CVP, central venous pressure. So when there is shock, hemorrhagic shock, then you can try tranexamic acid. It decreases the mortality. So it has a role in decreasing the mortality. So you can use it as well. Then the dose is 1 mg IV for 10 minutes, and after that 1 mg IV over 8 hours. So these were some important questions asked from the circulation. The shock is also an important topic because questions are asked on the type of the shock. Clinical based questions are asked. Then it's management. So how will you manage if a patient is in shock? So all these are a must do topic. Then moving on to the next important point is the disability, in which you will be looking for the neurological examinations by calculate the GCS, Glasgow Coma Scale, and along with that pupil also. So this is a table of the Glasgow Coma Scale, and the parameters we look in this is the eyes, opening of the eyes, then verbal response and the motor activity. So motor activity is the best parameter. So this is asked as a one liner. Which of the following is the best parameter to assess the Glasgow Coma Scale? So you need to by heart this whole table. Like if the patient is opening eyes spontaneously, then we will be giving him a mark of 4. If he is opening his eyes to the speech, then a mark of 3. To the pressure 2, and no activity, then we will be giving him 1. So likewise for the verbal response also we will be giving points, and for motor also. Okay. And if we add pupil in it, then it will be GCSP. So the parameters, so the marking for the pupil are like, the pupil will be not non-reacting. If both are non-reacting, then 2 marks. If one is non-reacting, 1 mark, and both are non-reacting, then 0. So this is the total score. Maximum will be the 15 points and minimum is the 3 points, and in the dead patient it will be 1. So by calculating these points you need to classify your patient into mild, moderate and severe. So if your patient falls in these categories, by using the number you will be able to classify them. So questions are asked giving a patient a full clinical case that your patient is not responding to speech, he is confused, he speaks few words and he is able to localize the pain. What is the Glasgow Coma Scale? So you need to calculate it and choose the correct option. So I suggest you guys to make a note of this and stick it on your study table, so that whenever you look at it you will be able to recall this Glasgow Coma Scale. Then the last and the most important part, this is the exposure. So we need to expose the patient to the environment to prevent hypothermia and keep the patient warm. So these were some important points from the ATLS protocol which you must remember. I had made these notes during my revisions and tried to fit all the important points in a single page so I can revise it multiple times and it will save my time. If you want this PDF, you can join me on my Telegram channel where I will be sharing the PDF, important topic, then flashcards, everything. You can also follow me on Instagram for more amazing videos related to the FMGE. Now let's look at some other important points which are asked from the general surgery. So hospital acquired infections. The most common is the urinary tract infection and the second most common is the surgical site infection, and the most common cause is the E. coli. And the grading used for this infection is the Southampton grading. There's no need to remember the points from this, only if you remember the name it's more than enough. So the next is a very famous question, that is prophylactic antibiotics. The best time is during the induction of the anesthesia. If this is given in the option, then you need to choose this as the answer. But if this is not given, then give before the surgery 30 minutes or 1 hour. Okay, so 60 minutes before the surgery, if you give the antibiotics, prophylactic antibiotics, it is the best time. So this was asked previous year question. Multiple times this question is asked as a one-liner and as a clinical case. Then now let's look at another two important questions, that is the SIRS, that is the systemic inflammatory response syndrome, and in this there are four components present. If more than two are present, then we will be saying that the patient is having systemic inflammatory response syndrome. So question was asked in the previous year that which of the following is not included in the SIRS. So there are four options here and you need to look कि कौन सा नहीं है उसमें and you have to choose it. ठीक है, so we will look at those components now. The temperature should be more than 38 degree Celsius or less than 32 degree Celsius. ठीक है, अगर 36 से 38 के बीच में है then it will be normal, but if it is more or less then we will consider it as abnormal and we will be giving it as a 1 point. Then heart rate, it should be more than 90 beats per minute. Then respiratory rate more than 20 beats per minute. And WBC की जो count है, it should be either more than 12K or less than 4K, 12,000 or 4,000. And according to that we will be giving the mark. और दो से ज़्यादा present है then the patient will be having SIRS. Then next moving on to another important स्कोरिंग सिस्टम, दैट इज़ द क्यू सोफा, और ये यूज़ करते हैं हम सेप्सिस के लिए. ठीक है, सो व्हाट ऑल पैरामीटर्स आर इंक्लूडेड इन द क्यू सोफा आर द रेस्पिरेटरी रेट, इट शुड बी मोर देन 22 बीट्स पर मिनट, द सिस्टोलिक ब्लड प्रेशर एंड द मेंटल स्टेटस, दैट इज़ द GCS स्कोर शुड बी लेस देन 15. सो आई थिंक दिस वाज क्वेश्चन आस्क्ड इन द Jan 24, लाइक विच ऑफ द फॉलोइंग आर द पैरामीटर्स ऑफ द क्यू सोफा. एंड एक नहीं था उसमें, कुछ और ऑप्शन में दिया गया था एंड यू हैव टू चूज़ कि जो ऑप्शन नहीं है उसमें. ठीक है, देन लेट्स लुक एट अनदर 2-3 important topics, that is the cellulitis, erysipelas and the necrotizing fasciitis. necrotizing fasciitis, mark my words guys, इसका तो क्वेश्चन हर साल FMGE में आता ही है एंड रिसेंट जैन एग्जाम में ये इमेज बेस्ड क्वेश्चन पूछा गया था फॉर नियर्स गैंग्रीन का. ठीक है, सो ये जैन में आया था एंड लास्ट ईयर में भी नेक्रोटाइजिंग फेसियाइटिस के बारे में पूछा गया है क्वेश्चन की वाई विल दिस इन्फेक्शन अकर. सो इट इज़ पॉलीमाइक्रोबियल इन्फेक्शन एंड इसके दो टाइप से, अगर ये एब्डोमेन में होगा देन इट इज़ कॉल्ड एज द मेलिनीज गैंग्रीन एंड इफ इट इज़ ऑफ द स्क्रॉटम देन फॉरनियर्स गैंग्रीन. और हाउ डू यू ट्रीट दिस पेशेंट, दैट इज़ वी विल बी गिविंग द IV एंटीबायोटिक्स प्लस डिब्राइडमेंट. सो वन क्वेश्चन इसमें से तो आएगा ही आएगा नेक्रोटाइजिंग फेसियाइटिस के बारे में. ठीक है, तो अभी और दो और इम्पॉर्टेंट चीज़ें देख लेते हैं, दैट इज़ द सेल्यूलाइटिस एंड द एराइसिपेलास. तो सेल्यूलाइटिस मीन्स इट इज़ इन्वॉल्वमेंट ऑफ द डीप और डर्मल प्लस सबटर्मल लिम्फेटिक्स. ठीक है, लिम्फेटिक्स की इन्फेक्शन की वजह से ये होता है एंड द कॉजेटिव ऑर्गेनिज्म इज़ द ग्रुप A स्ट्रेप्टोकोकस. And how do we differentiate between the erysipelas and the cellulitis is, cellulitis will be ill defined, the margins are not defined properly, we cannot differentiate between the good tissue and the bad tissue. But whereas in erysipelas the margins are well defined and we can easily differentiate that कि ये infection कितने area में फैला हुआ है. The erysipelas, it is the infection of the superficial or the dermal lymphatics, and causative organism इसका भी streptococcus है. And treatment of both is also the same, that is the broad spectrum antibiotics. So in this video I have tried to cover the most important the 5-star topic questions which have been repeating every year. So I hope this video will help you guys. So that's all in this video guys. I hope this video will be useful to you and it will help you all in your preparation. तो जितने भी अभी मैंने टॉपिक्स डिस्कस किए प्लीज़ इसको करके जाना. यू विल बी ईजिली गेटिंग 2 or 3 marks फ्रॉम दिस हाउ मच आई हैव डिस्कस्ड नाउ. ठीक है. सो बाय बाय, ऑल द बेस्ट फॉर योर एग्जाम्स एंड गुड लक फॉर योर प्रिपरेशन.